Welcome back to Sunny Morning, and we are still here talking to Dr. Wahid Burat. And we have a few questions for you, more questions for you, Wahid. I hope you don't mind,
No, I don't
Dr.
mind.
Wahid.
It's a real education. I'm learning a lot from you
We're
this morning.
learning a lot, aren't we? Well, one of the things that I would like to ask you about is people normally complain about really strong headaches, or like the shoulder ache or the stomach ache and different aches. So what would you tell us about it? Like, it could be dangerous at certain point, and which point about it?
Well, headache is one of the main kind of not only painful situations that we can get through, but also disability kind of situations. We can talk a little bit about a few, like the migraine kind of pain, but also tensional headache, and there's some others like vascular kind of headache, and there's so much things that can happen. It can be just like some people have headache because they like drink wine. Okay, or they can have headache because they're in their phones, with the head kind of bending down,
yeah.
like so many hours a day, or in the computer, so kind of tensional headache. Or they can have headache also because maybe they need some glasses.
Let me interrupt for a second, because it's very important before I forget.
Sure.
You are mentioning that that actually the headache could be from a different source, right?
There's different sources of headache.
However, what people think about the headache, they have a headache, just a headache. They don't know where it comes, what's the source. Then doctors know it because they are the doctors, you are the doctors, but people, we don't know. And what's the most common answer from anybody regarding the headache?
Okay, well, headache, as all the other things we have a statistics of what the headache can be about. Usually it's tensional headache, and there's some diagrams that people can watch, look in the internet, that says if you have your headache here, it's tensional, but if it's here, it starts to all the different kind of headaches, and that's not always totally true. It kind of helps. There's people that have only half of the head.
It's true.
Okay, so we have to do. I remember when I was studying my neurology part of my training, and headache, it's such a big, the big class with all the big, the talking to the patient, the history of the patient. So important to know what the headache is about. When the people get with me, usually have a theory of what the headache is about. I slept in a
Wrong
awkward
position.
position, or I wine, chocolate, or maybe a car accident a month or years before, that they still have headache. I've seen people with 10 years of headache continuously.
And they suffer through that so many years. They can't kind of put their finger on why.
I have people that headache became face kind of ache, with the eye, and there's a lot of headache that has to do with the TMJ, temporomandibular joint.
Yeah.
So when we are the joint, when we're like chewing, it's kind of like a knee. So it has a joint capsule, a meniscus, it has ligaments and nerves, and sometimes I've had people that they go to a dental procedure, they kind of spread wide open the mouth, they sprain the joint, that joint becomes unstable, then it becomes painful, then they have headache or face kind of ache, and it's something like it's a joint. Sometimes it can be migraine, or we have to look what it is.
See, that the message is very important, because we don't can just say, oh, I have a headache and I think I slept wrong, in the wrong position. We need to pay attention, especially, I assume, when it comes back and keeps coming back, right? Then we should pay attention to that.
Specifically there.
What about stomach? There's that common dull stomach ache type of pain, and if it's like to the right-hand side of the abdomen, does that trigger your sort of a response for me quickly?
Well, usually when we are trained on our diagnosis skills, we are like, to palpate the stomach, and if it's in the right upper angle, so maybe it's the liver, or if it's in the, so if it's down also the appendix. So,
could be an appendix,
but
yeah.
usually people, say in here in Mexico, we are refers to the epigastric area, where specifically where the rib cage like finishes, and there they say, like the boca del estómago, it's like the mouth of the stomach. That's what people say. And
The
it's usually-
center, the plexus,
exactly,
the solar
the
plexus.
center of the stomach. People also refer of a lot of pain there, but we have to accept our diet. We eat a lot of times, and our food usually it's very, how do you say, with a lot of spices and a lot of
Chemicals and hormones.
Even processed food is the worst.
yeah.
Process-
So there's a lot of dyspepsia also.
Yeah.
The stomach is saying, you know what, you have to go on a diet. It's like really.
It's telling you, that pain is telling you change,
Yeah.
right?
You
Time
have
for
to change something. You have to change something for sure.
Well, let me ask you a question about talking about imbalance. Just comes to my mind when the hormones. I think it's very important. This subject, when they are unbalanced on men and women, what would be the risk? Because
Well-
that's something that we really definitely we don't know how
Okay.
our hormones are.
Okay, our
Right?
bodies
No, absolutely.
depend on hormones. Those are one of the main or the most important transmitters of information between our glands, our brain and our different glands. So usually women are the ones that kind of go to the doctor to check their hormones, and specifically when all the menopause things and starts. But usually, since the younger age, with the new blood works and some imaging, so we can have control of that. Men, it's a different story. Men, we usually don't like going to doctors, and we try to think things are always all right. So in men, finding a hormone imbalance, it's a little bit tougher.
Difficult?
Yeah, it is. So there's pain due to hormones. Let's say a guy that has 40, 50 years old. I'm not saying, older. After 35, our testosterone starts dropping. When the testosterone drops, our muscles stop growing. So actually, we start losing
Muscle.
lean muscle mass. Okay, lean muscle mass. So when we have this situation and our muscles are weaker, our joints work under heavier stress. So
okay.
So I won't be able to fix that knee if I'm not fixing the hormone that it's making the whole chain of events kind of,
Well, that makes
happen.
it tougher for us, right?
Okay.
To find out.
So there's also very, very specific pain related to thyroid imbalances.
Yeah.
Okay?
Exactly.
It can be to the low side of having less
Thyroxine?
thyroxine, T3 or T4 hormones, or it can be to the other side, producing a lot of thyroid hormone. So that's one of the main hormones that when it kind of makes an imbalance, and it messes up kind of all the other things
Everything
around.
else.
Yeah. Okay. So very important to check the hormones.
So, well, we're going to be talking also a lot about which other causes could be like an imbalance of hormones. What could cause, like, as far as liver, diabetics, or like anything that people we should know about how to take care of ourselves.
Sure. So there's a lot of situations but people usually they don't check themselves. We, at least here, we have the culture of treating, not of preventing. Okay. Some other countries, they're a little more into the preventive medicine, but we have here practically we treat. So, but once we treat, it's because we found something, and when we do that, maybe it's been there for 10 years. So sometimes all the changes that happen already in the body, they're not easy to get them back to normal. Specifically, not in the time frame that the patient wants. I want to be good in 2 days. Okay, so this has been happening for 20 years, so we can't.
Exactly. That's impossible, basically.
Yeah, I mean, years and years of probably I not say self-harm, but neglecting oneself. And this is the whole point today. Pain, recognizing pain, managing pain, preventing getting there before the pain starts.
That's right. We have specifically epidemics of obesity and pain.
Huge in Mexico.
Pain comes with I say, these big 20 liters of water bottles.
Yeah.
Okay, so I say to people, sometimes you're like walking around with 2.5 liters of water, going up and down stairs for 20 years of your life. That will, mess your knees.
So it takes its toll.
Definitely.
Sure. Completely
Definitely.
does.
Well, we have a lot more with Dr. Wahid because in the next segment, he's going to let us know what to do. Best important thing, right?